Hey, everybody. I'm Michael Clark. Welcome to Facts at 5. I'm joined here with my counterpart, Morgan Vaughan. Hi, Morgan.
Hi, Michael.
And we're here at LTV Media Center in Waynescott, New York. It is Monday, March the 23rd. Am I correct in
You
that?
are correct.
Am I close?
Close.
Okay. So we bring you the locally focused, fresh, and validated information Monday through Friday, 5 o'clock. And how was your weekend?
It was, isolating.
It was isolating.
It was me and my husband and our dogs in our house, and I learned about making masks because we're going to have to make masks at some point, or people are asking to make extra masks.
Okay.
These wouldn't be hospital grade, but they would be for some people. If you can sew, you can look up online how to do this. It was really fun. I mean, that's a skill that I never use anymore, sewing.
Making masks.
Making masks.
Had you made masks previously?
I've never made a mask before,
Okay.
especially a hospital,
right.
that kind of mask. But if you know how to sew, if you have a 3D printer, there are ways to do this.
Cool.
The other thing that I did was I ordered out last night, which we never really do that. But and if you go to easthamptonstar.com, they have a whole list of the eateries that are now doing takeout and delivery, because you have to, as a restaurant, in order to stay in business right now, because nobody obviously can sit in. But the people out here, the restaurants out here, are doing a bang-up job.
So where did you go?
I went to
not that
Rowdy
we're
Hall.
promoting anyone, but...
And it was unbelievably well organized and fantastic.
Wow.
So I called around 3 o'clock or something, and I think that's when they open. And the gentleman I spoke with said that I took my order, he was great, and then he said that in lieu of gratuity, they're accepting money for a fund that they're going to use for the service they had to lay off.
Oh, that's great.
Fantastic. So that was what we gave in lieu of gratuity. I went there to pick it up at 4 o'clock. It was all usually how you walk in and there's the bar. Everything was lined up like little soldiers, your food, your bill, you sign it, and you go.
Wow.
It was so well organized.
Pretty efficient,
and
yeah.
so efficient. And I cannot thank them enough, but I also know that other eateries are doing this. People are stepping up all over the place.
That's
It's
great.
really fantastic.
That's wonderful. Yeah, I mean, it's one of the things, I mean, we're pizza people, so.
Well, there you go.
We had a little bit of that.
Pepperoni's is now doing it. I saw that. Sag Pizza.
Yeah.
I just saw this updated today.
So I'm just going to touch on it for a second. A couple of things.
Sorry.
A couple of things that we're going to be talking about today. We're going to update on what's happening, obviously, with coronavirus. You're going to talk a little bit about the schools, I hear. And then we're going to talk a little bit about random acts of kindness and what's going on locally with that. So let me start with some of the fast facts. You guys have heard this probably a lot already, but Suffolk County has now surpassed 1,000 coronavirus cases. The town of East Hampton now has 10 confirmed cases of COVID-19. Southampton has 16. 2 on Shelter Island. Southold Town has 91 confirmed cases. On Saturday, unfortunately, the 4th death was reported connected to COVID-19 at the Peconic Landing Retirement Home. Some old folks over there that it's really sad. And today is the first official pause day where Governor Cuomo has really come in and put the hammer down saying, okay, we start now, and what part of this are people not understanding? Did you see the press conference at all with him? I mean, it was quite impressive in terms of, him just saying, I don't know what else I need to do here to make you understand that this is really important.
Well, a huge thing that happened yesterday that I was not expecting personally, and I had just seen a Hampton Jitney go by when I was going to Rowdy Hall and there was nobody in it, is that Hampton Jitney is now suspending its service until April 9th.
Wow.
Which, ever since I was a kid, there was a Hampton Jitney. I think it started when I was around 8 or 9, maybe a little younger. But the idea that they've suspended service for almost 2 to 3 weeks, unprecedented.
Yeah, there's probably nobody on it.
There's probably nobody on it, but it is a big deal. And if you have tickets, you can go to hamptonjitney.com. You can figure that all out. But it is it's part of the pause.
Yeah. And it's great. I mean, I thought it was pretty cool that he did a surprise visit to New York City and saw people romping in the park and whatever, and went to the mayor and said, you have 24 hours. I need a plan on my desk. And
Right.
I haven't heard anything on that yet today, but more on that to follow, I'm sure. Just a couple of other quick things I just wanted to point out, and this comes from Fred Thiel's office, and you may have heard this as well. But local schools and businesses are offering free grab-and-go meals. This is pretty much in Suffolk County for kids who need them. And you spoke about this on Friday, I
Yeah,
think.
East Hampton High School is definitely part of that solution, and probably the other schools that I don't know about because I'm in the East Hampton district.
Right.
So that is something to check out. But I think it's every day of the week, and then on Friday they give you something for the weekend.
That's great.
It's amazing.
That's great.
They're going gangbusters over there.
And PAWS didn't know that PAWS stood for Policies Assure Uniform Safety for Everyone. Did you know that?
Yeah, I did.
You did? All right. I was absent that day. And it took effect last night, obviously. And today's the first full day where they're requiring non-essential businesses that are deemed non-essential to have 100% of their workforce at home. Something else, just in terms of financial relief, the state debt collection, on student debt and medical debt will have payments frozen for at least 30 days,
okay.
which is
That
good
could
to
be
know.
Helpful, yeah.
You're probably still paying off your college loans, are you not?
Oh, yeah. When I went to college, it wasn't as expensive.
No, I know. I thought it was, but it's all relative, I guess,
It's all
right?
relative, yeah.
And they also rolled out a new 90-day mortgage relief period, and foreclosures are suspended or postponed for those facing financial hardship because of COVID-19. There is now a 90-day moratorium on commercial and residential evictions as well, as per the mayor. I'm sorry, as per the governor. So that's kind of it that I have on.
I think that speaks, though, to the fact that it is scary to feel financially in trouble.
Yeah.
This is a strange time, too, because we're not only scared of getting a virus, we're scared of losing our homes, we're scared of not being able to pay bills, we're scared of everything. It's sort of like everything happening at once, which is, in my life, usually it's one thing,
right.
you know? But I think that what's interesting about this is that really this is happening to everybody.
Yeah.
This is not, everybody's scared. Everybody's scared. And that's one of the reasons why we're doing this, is we want to give people a sense of community and of consistency throughout their day.
Right. A little bit of understanding of what's going on. And so why don't you talk a little bit about the schools? You know, we've been, you and Angela and bunch of folks
things are moving really fast at the schools, and one of the things that I understand is that the online or distance learning isn't really starting until March 30th because next week is spring break.
Okay.
I have a couple of friends who are teachers, and they're telling me that it is one of the things everybody needs, and I think we can all identify with this, is that we're all kind of figuring this out as we go along.
Yeah.
And they need to have patience with everybody. From both people that I spoke with and then some other people that I spoke with, and something that we can speak to here is the issue of technology. It's all well and good to say you're going to do things from home. It's another thing to actually make it work.
Right.
And some people have better Wi-Fi in connection. Some people have computers. Some people don't. Some people, I mean, it can be more complicated than you think within 2 seconds.
Right.
And if you're dealing with a bunch of students, it can be very complicated. So I think everybody needs to sort of realize that this has never happened in the history of anything.
Right.
We are all working it out as we go along, and just to have a little grace and patience with each other. One of my friends who's is reading books, you know, because she's a kindergarten teacher and reading books so that they can see the books. But then there's technical issues with that are, you know, they're great, but it's just, she said, and I thought this was great, she's like, I really appreciate the skill it takes to film and broadcast stuff now.
Well, yeah.
Because when you're doing it, it seems so easy.
Yeah.
You just do that. No, it's not just.
Right, exactly. And, we automatically think also that everybody has access,
Right.
and to your point, they simply don't. I know the school system has about a couple of hundred Chromebooks, I think, that they're
Right.
looking to get to people so that they can be able to access and do that. But then there's still internet connection and things like that. So it's going to be really hard. They have their work cut out for them to make sure that people aren't falling through the cracks and people are getting the type of learning that is required, really.
But on another positive note, there are a myriad new things that are popping up to help kids learn. So if you're teaching from home, you can help, engage your children throughout the day.
Right. Yeah, I just saw something also that Project Most even had something come out. They have an online thing that you can access and keep the kids busy
fantastic.
During a learning experience. Yeah, they're great with that.
Yeah, we never appreciated teachers more, I don't think. I think
they are not paid
this
enough
situation,
money.
We love the teachers, we love the nurses, and we love the grocery store people.
Right.
It's
Sometimes
fantastic.
we
I love it.
There's a lot of things we take for granted.
Yep.
I'm seeing it every day in all different parts of what's going on. But yeah. So how about random acts of kindness? Some things, right? They're do you know Captain Chuck Marishi?
I don't know him personally, but I'm a big fan of his latest video.
Right.
Yeah.
Why don't you tell us about it?
Well, if you haven't had a chance to see this guy, this Montauk fisherman, I guess he went out last Thursday with another fisherman, and they got about 1,000 pounds of fish, stood on the pier pier at Montauk and gave it away to people.
Yeah.
This video was hilarious. I actually wrote to him to see if he would let us play it on LTV. But he is a real salt of the earth kind of Montauk guy that we love, and this is our community. This is what he said. I don't want any money. You can't take any money. I just want to help your old people. He said, call your neighbors. I actually did call my neighbor, and I honestly think she was a little offended that I thought she was old. I was like, I just was actually checking in because how now you don't really know your neighbors.
Yeah.
But I saw that they were here, so I thought, I'm going to text her and see how she is. And then I kind of felt like she was like, oh my gosh, she's checking in on me because she thinks I'm old. I was like, no.
She's not talking to you any longer. Yeah. But speaking of that, over at the senior center, more random acts of kindness, right? Those 60 and over will be able to pick up frozen meals at the senior center on Springs Fireplace Road starting today.
Fantastic.
And all they need to do is call ahead to arrange for a pickup time. And if they're not available to come in and pick it up, they will actually drop it off as well. So you need to contact Human Resources, Town of Human Resources, who are amazingly busy right now, just in terms of everything that they're accomplishing and doing. I know Peter Van Square was speaking about it on Friday. But their number is 631-329-6939, and we'll be showing that again at the end. And Meals on Wheels also said that they have no intention of slowing down. They're just going, so if you're looking for volunteer opportunities, you can contact Meals on Wheels. You can contact East End Cares, who's got their hands in anything there. You can find them on Facebook or looking them up online. But in addition, the town is collaborating with local food pantries, child care centers, and other volunteer organizations, just making sure that we're putting our time and resources into the right direction. So once again, you would need to contact Human Services about that. So, boy, this time goes really quickly. We're winding down. And
we taped earlier with Mayor Lawler and Deputy Mayor Barbara Borsack, and they are going to be on next just after this. The connection wasn't great, but the information was really good. One of the biggest things, and I was also contacted by the East Hampton Village Ambulance Association, is what the information Barbara's going to talk about, which is being really mindful of calling 911 or going to the hospital for anything other than a serious emergency.
Right. No, it makes sense totally. And just so you know, folks, what we're working on, you'll see this in this particular segment with the mayor and the deputy mayor, is that we're trying out the system so that we can be remotely. Morgan and I have the 6-foot table between us here, and there's only three of us in the whole building.
But whatever you got, I got at this point.
Exactly. Right. So, so we're trying out this new system, and you'll see it jiggles a little bit and stuff like that, but that's the connection on their end, and it's a way that we're going to be doing probably village meetings and town meetings and architectural review board and all those kind of things moving forward. So we're still working out the kinks.
And we might be remote tomorrow or the next day
We
or
might
whatever,
be.
but we'll try to bring this to you every day.
We absolutely will. So once again, thank you all for everything that you're doing. Thank you, Morgan. Good to see you. I'm glad you had a good meal this weekend. I don't know where that came from. But we will see you all tomorrow. Thank you very much for tuning in.
Hi there. So we are welcoming Mayor Lawler and Deputy Mayor Barbara Borsack today. And I really just want you guys to be able to tell people who live here, just inform them of what's going on with the village in response to this crisis.
Okay, so thank you very much for having us, first of all. And we'll start by just giving you some of the numbers.
Okay, great. Thank you.
So, as of yesterday, Suffolk County is up a little bit over 1,000 cases that have tested positive. On the East End in East Hampton town, there are a total of 10, which includes us here in the village. And there are a total of 2 positives here in the village, and 1 that is self-quarantined that has not returned a positive test yet. Mm-hmm. So 2 positives and 1 self-quarantined. As far as what I can report for the public, first let me tell you that there is a mobile test site at Stony Brook University in the South Lot P. And you can call the following number, 888-364-3065. They will triage you on the phone, and if you meet their criteria, they'll make an appointment for you to come in and be tested.
Great.
So here in the village, our village staff, except for police, fire, and EMS, is been decreased to at least 50%, in some cases slightly less, in order to limit the amount of contact among our staff. And we've closed Village Hall to the public, but you can contact us via phone or email, or if something precludes you from doing that and you have to come to Village Hall for business, you could knock on the door. Somebody will come to the door and make arrangements to accept an application or something like that. But we would prefer that you do all of that by email or phone if possible.
Okay, great.
Regarding our public meetings, we're working on teleconferencing our meetings where possible. There may be some legal implications to certain meetings where we may not be able to do that, but we're in the process of trying to do that where we can. Again, teleconferencing, maybe we would have a situation where people could call in with questions during one of our meetings or something like that. What we've done also to help things move along is that we've extended the expiration date for some of our permits, such as our building permits. So if somebody's building permit is about to expire, within the next 60 days, we've extended that expiration 60 days without a fee. So they won't incur another fee in order to extend their building permit. We have closed down the playground area of Herrick Park. We left Herrick Park open. We've closed down the playground area of Herrick Park, and it is ropes off and signed off so that people know that they shouldn't be on that equipment, because experience is telling us that the virus can survive up to 72 hours or longer on plastics and metals. So that's why we've closed down that equipment. Just as far as emergency dispatch, I can tell you that what we're doing as far as our dispatchers are concerned is when they report for duty, they don a mask, and their temperatures are checked before they come into the actual dispatch area and start their tour. So if you call them on 911 or 631-324-0777, and somebody picks up and you are requesting emergency services at your location, they will ask you if you have a cough, if you have a fever, or if anyone at your location has been quarantined.
Okay.
And then they will, of course, get your location and what your emergency is. So when police or fire or ambulance respond, they will respond appropriately with the appropriate protective gowns and or masks. Most likely, depending on the circumstance, only one of the responders will enter the home. They will some of the same questions that you've already been asked before, just to confirm that there is no threat of the virus at the location. And if there is, then they will take proper procedural cautions in that particular case.
Okay, great. I wanted to ask you, if I could interrupt for a second, I wanted to ask about
Sure.
masks, because we've been hearing a lot about how there aren't enough masks for people. How is the setup for that?
Barbara, maybe
I
you
can
can speak to
answer
that.
that. The ambulance right now has plenty of the small masks. The N95 masks are what is the issue. Those are the ones that are in short supply. We have enough right now, but one of the reasons we are trying to encourage people not to call unless they have a true emergency is that we have to treat every call as a possible COVID-19 call. Okay. So for every call, we are using these masks and full gear, gowns, face masks, N95 masks, double gloves. So we're using our equipment on every ambulance call. And that equipment will run out if we are overwhelmed.
Right.
So we're asking people, first of all, if they feel they need an ambulance, if they're having chest pains or if they think they're having a stroke or a family member thinks they're having a stroke, please, yes, call immediately. But if they do not fit into that category for true emergency, call their healthcare provider first, their local doctor, and ask their doctor for advice. And if the doctor recommends that they go to the emergency room, then we'll, of course, transport them to the emergency room. As Rick said, only one person will go into the house. We will ask them to come out of the house to meet us, if at all possible. We will maintain a distance from the patients as necessary. We have to sanitize the ambulance after every call completely, so it's a long process for us. If you have a family member that can drive you to the hospital, that would be better. Okay. So just be aware of that. We are, of course, there for emergencies, but we don't want to overwhelm the system. We don't want to overwhelm the ambulance system or the emergency room at the hospital.
So if you think,
does that make sense?
Say that I think that I have COVID-19.
I don't know if I lost everybody.
Oh, you did? You can't hear anybody? Okay, but let me reiterate what Barbara was saying was that, and I think the Ambulance Association has said this as well, to make sure that you're not going to call if you have just a cough, but this is for true emergencies at this point. Mr. Lawler, while we're getting Barbara back, what about the what kind of rules do we have in the village for population density, for people walking around, for all the people who've come out?
Sure. Well, the idea is that people should get out and get exercise. It's good to be out in the sunlight. That's deters the virus. And so, sure, we would like people to be out, but they should maintain a social distance of at least 6 feet. Okay. And obviously, if they're comfortable wearing a mask and they have a mask, that's fine. We're told that that's not necessary if you're going to maintain social distance. As I said, we closed down the playground areas, knowing that children would unlikely think about those types of things. So the park is still open if people want to, do something in the park and maintain that social distance. We also have walkers that come through the park from the long-term lot to get to other services in the village. So that's another reason that we have not closed down the park entirely. Okay.
Is there any other information that you really want to get out to the village constituents here?
Well, just that, of course, the situation is serious, but we don't want anybody to panic. We think that we have things under control. And yes, we expect that the numbers may rise out here, although we've been able to keep them relatively low so far. And, we anticipate that we are doing what is necessary in order to maintain that. So we're hoping that condition will, continue.
Okay, great. Barbara, are you there?
Yeah. Okay.
Can you hear? Do you have anything you want to add?
I think mostly that we want to make sure, people have asked us about beaches. They would like us to close it. It's very difficult, open, public spaces, but we really encourage to keep their distance.
Could you repeat that because you cut out a little bit?
We've had some people ask if we couldn't close the beaches because of the crowds on the beaches. And that's a difficult thing to, if we're closing beaches, we're closing public spaces.
Right.
We just really want people to maintain distances and be smart.
Okay, great. All right. Is there
Just
anything else?
And just one last thing. We've had a lot of people calling in about construction sites that are still, workers are still there and working. And we've been working very hard to get determination from the governor's office as to whether or not they are essential service.
Oh, okay.
So we haven't closed any of them down yet, but they are, we're beginning to hear from the governor's office that they are included in essential services. So we're not going to shut down construction sites, but we are advising them to take, sensible precautions like everyone else, and maintaining a distance and only having the amount of workers that they absolutely need to do the job for that day.
And
Excellent.
one more thing, I think people should be aware that things are changing every day. There are conference calls with the state and the Department of Health, and so things rapidly. Every town website and the village website have updates, have a Facebook page, so they could check for the latest information on any of those sites.
Okay, great. So I just want to reiterate, because you were cutting out a little bit, that people should visit easthamptonvillage.org and ehamptonny.gov. And I have both of those websites on at the end so people can see it, and your Facebook pages, which are great.
Great. Yes.
Okay. All right.
Yeah.
Thank you so much for, being here and helping us get the word out.
And thank you for
welcome.
having us.